Symptoms of scabies. The main symptoms of scabies are intense itching and a rash in areas of the body where the mites have burrowed. The itching is often worse at night, when your skin is warmer. It may take 4 to 6 weeks before the itching starts, because this is how long it takes for the body to react to mite droppings. Symptoms will start within 1 to 2 days if you've had a scabies infection in the past. This is because your immune system will have learned to respond to a scabies infection. The rash. The scabies rash consists of tiny red spots. Scratching the rash may cause crusty sores to develop. Burrow marks can be found anywhere on the body. They're short, 1 centimeter or less, wavy, silver-colored lines on the skin, with a black dot at one end that can be seen with a magnifying glass. In adults, burrow marks often appear in the following areas: the folds of skin between fingers and toes, the palms of the hands, the soles and sides of the feet, the wrists, the elbows, around the nipples in women, around the genital area in men. The rash usually affects the whole body, apart from the head. The following areas can be particularly affected: the underarm area, around the waist, the inside of the elbow, the lower buttocks, the lower legs, the soles of the feet, the knees, the shoulder blades, the female genital area, the groin, around the ankles. Elderly people, young children, and those with a low immune system, immunocompromised, may also develop a rash on their head and neck. Men usually have 1 or more very itchy, lumpy, 3 to 10 mm spots on the skin of the genitals, on the penis and scrotum. In infants and young children, burrow marks tend to appear in different places on their body, including on the face, head, neck, scalp, palms of the hands, soles of the feet. Scabies mites leave small red blotches and silver-colored lines on the skin. These marks are caused by the mites burrowing into the skin. In infants with scabies, blisters and pustules, small blisters that contain pus, may develop on the soles of the feet and palms of the hands. Causes of scabies. Scabies is a skin condition caused by the parasite Sarcoptes scabii. The intense itching associated with scabies is thought to be caused by the immune system reacting to the mites and their saliva, eggs and feces. The scabies mite life cycle. A scabies infestation starts when a female mite burrows into your skin. Male mites move between different burrow sites looking to mate. After mating, the male mite dies and the female begins to lay eggs, which hatch around 3 to 4 days later. After hatching, the young mites move to the surface of the skin, where they mature into adults after 10 to 15 days. Male mites stay on the surface of the skin, while female mites burrow back into the skin to create a new burrow. The life cycle is then repeated. Without effective treatment, the life cycle of the scabies mite can continue indefinitely. Scabies mites are resistant to soap and hot water and can't be scrubbed out of the skin. How scabies is spread. Scabies mites can't fly or jump, which means they can only move from one human body to another if 2 people have direct and prolonged physical contact. For example, scabies mites can be transmitted by holding hands with an infected person for a prolonged period of time, having sex with an infected person, sharing clothing, towels, and bedding with an infected person, although this is rare. It's unlikely that scabies will be transmitted through brief physical contact, such as shaking hands or hugging. Scabies mites can survive outside the human body for 24 to 36 hours, making infection by coming into contact with contaminated clothes, towels, or bed linen a possibility. However, it's rare for someone to be infected in this way. Scabies infestations can spread quickly because people are usually unaware they have the condition until 2 to 3 weeks after the initial infection. There's an increased risk of catching scabies in confined environments, such as schools and nursing homes, where people are in close proximity to one another. Treating scabies. See your GP immediately if you have scabies and you haven't had a previous infection. Delaying treatment places other people at risk. as other more serious skin conditions can sometimes cause similar symptoms to the symptoms of scabies. Your GP will need to rule these out. If you have scabies, your partner will also need to be treated regardless of whether or not they have any symptoms. This is because it's highly likely that scabies will have been transmitted through close bodily contact, such as during sex. To reduce the risk of reinfection, avoid having sex and other forms of prolonged close bodily contact, such as holding hands, until both you and your partner have completed the full course of treatment. If you've been diagnosed with scabies, you may be advised to visit your nearest sexual health clinic to be checked and, if necessary, treated for other sexually transmitted infections, STIs. Lotions and creams. Lotions and creams are commonly used to treat scabies. Your GP, pharmacist, or nurse will be able to advise you about which treatment to use. Applying the cream or lotion. To prevent reinfection, all members of your household and any close contacts, including recent sexual partners, see Diagnosing Scabies for further details, should be treated at the same time as you, even if they don't have any symptoms. The cream or lotion should be applied to the skin of all of your body, except your head. Before you apply it, make sure your skin is cool and dry. Don't apply it after having a hot bath. If you apply it when your body is hot, it will quickly be absorbed into your skin and won't remain on the area where the scabies burrows are. You should also follow the advice outlined below. Read the patient leaflet that comes with the cream or lotion for details of where to apply it. Some products need to be applied to the whole body, including the scalp and face, whereas others must only be applied from the neck down. Pay particular attention to difficult-to-reach areas, such as your back, the soles of your feet, in between your fingers and toes, under fingernails, and on your genitals. Use a cotton bud or old toothbrush to apply the treatment under fingernails and toenails. Put the cotton bud or toothbrush in a bag and throw it away afterwards. Leave the treatment on your skin for 8 to 24 hours, depending on the preparation used, before washing it off thoroughly. Follow the manufacturer's instructions regarding how long to leave the cream or lotion on for. Reapply the cream or lotion immediately to any areas of skin that are washed during the period of application. Wash bed linen, nightwear, and towels after the first application. Repeat the treatment process 7 days after the first application to ensure it's successful. The second application will ensure any mites hatched from existing eggs are killed. Contact your GP if the itching hasn't improved after 2 weeks of treatment and you notice new burrows on your skin. It can take a month after treatment for the general itching to subside completely, and longer for the lumpy genital lesions to resolve. Your GP may recommend repeating the treatment or they may prescribe a different lotion. You should also speak to your GP or pharmacist if you experience any persistent side effects. Infection control. On the day you first apply the cream or lotion, you should wash all bed linen, nightwear, and towels at a temperature above 50 C, 122 F. If you're unable to wash certain items, place them in a plastic bag for at least 72 hours. After this time, the scabies mites will have died. In cases of crusted scabies, you should clean the floors in your house and thoroughly vacuum your carpets and furniture, including the armchairs and sofa. If you've been diagnosed with scabies, avoid close and prolonged physical contact with others until you've applied the cream or lotion. You should also avoid close contact with other members of your household until their treatment has been completed. Children and adults can return to school or work after the first treatment has been completed. Itchiness. Your GP should be able to prescribe treatments, such as a mild steroid cream, to reduce the itchiness. Menthol cream or gel, available from pharmacies without a prescription, may also help relieve itchy skin. Oral sedative antihistamines are also available from your local pharmacy and can be used to control itching and help you get a better night's sleep. As this type of antihistamine can cause drowsiness, you should avoid driving or operating heavy machinery if you're affected in this way. Non-sedating antihistamines don't help relieve the itching of scabies. Check with your GP or pharmacist if you're unsure. You may continue to experience itchiness for a couple of weeks after your treatment has been completed. This is because your immune system will still be reacting to the presence of dead mites and their droppings. Visit your GP if you're still experiencing itchiness 6 weeks after completing your treatment.